Good morning and good afternoon. Thank you for joining me live today on this lovely Wednesday. My name is Julie Helmus. I'm an optometrist and private practice owner in Davis, California. Both my parents are retired optometrists, so I took over my family business. I actually grew up alongside Helmus Optometry. We have one location. We're a large practice. To provide context, I employ 5 associates and 26 full time equivalent staff. And I'm proud to report that last year in 2023, we grew 19% and brought in over 4 million in revenue. Now, as a large office, we can offer a variety of subspecialties, including ocular disease, dry eye, myopia management, and advanced contact lenses such as sclerals and ortho-K. Today, I'm here to talk about my newest subspecialty, and that's our migraine center. We've been prescribing Avulux migraine and light sensitivity lenses in my practice for the past year, and I've used this new technology to create a subspecialty. Now, for years, patients have asked me, as they probably ask you, about their migraine headaches and their light sensitivity. I've had patients report that they wear their sunglasses indoors or that during a migraine attack, they're confined to a dark room. And until now, I've felt pretty ill equipped to help our patients. But I'm excited to report that we now have a safe, rewarding, clinically proven, and profitable tool to help our migraine patients. Wouldn't you like to better be able to serve this population? I say it's time optometrists join the conversation and take a larger role in the management of migraine, especially given that 90% of patients or people living with migraine experience light sensitivity. And a majority of migraine attacks are actually triggered by light or glare. Now, this is all too common. We all know someone who lives with migraine, whether it's yourself or a spouse, a family member, colleagues. I used to have multiple employees used to call out with migraine headaches. Now, I would argue that migraine is actually has better name recognition than myopia or presbyopia. And that's because it's the second leading cause of disability worldwide. That statistic blew my mind. So, what we're talking about here is a chronic condition with no cure that impacts 48 million Americans. That's 1.5 to 2 out of 10 of your patients. So if you're seeing 20 patients a day, that's 3 to 4 patients walking through your exam room every day who live with this chronic painful condition. Are they bringing it up to you? Are you systematically and routinely screening your patients for migraine headaches and light sensitivity? This impacts women way more than men, actually 3 times more women than men. And unfortunately, it strikes us during our peak professional years. Now, any issue that disproportionately impacts women should have our attention. Why? Because private practice optometry straddles healthcare and retail, and every retailer in the world wants to reach this coveted demographic of women between the ages of 19 and 60. We know that women are our big revenue generators. They're more likely to spend in our optical. They're also more consistent with their healthcare, and they're often the keepers of the family schedule. Now, the reason this subject is near and dear to my heart is because I am a 39-year-old woman and I have been living with migraine headaches for 25 years. Classic patient, right? I get that unilateral pulsatile headache, 8 out of 10 pain, and I can't let it prevent me from going on with my day. I need to manage my practice, attend to my children. I must look at my computer and my cell phone. So at first, I started with 200 milligrams of ibuprofen and then I upped it to 400. Then I got a prescription for sumatriptan, which I don't like taking because of the side effects. It makes my gums sensitive. Anyway, we know that a lot of our patients are on migraine medications and that there are many medications available. However, again, there's no cure. These medications, they're often recurring. They can be very expensive. And tachyphylaxis is an issue. So maybe a certain migraine med works really well for a patient for the first 9 months or maybe the first couple years, but eventually, all too often, the efficacy wanes. Avulux lenses, what I call my migraine glasses, are safe. There's no recurring cost. We're talking about a pair of lenses, and it can be used in conjunction with a patient's migraine medication. So they are a safe complement, again, with no side effects. So, how do these work? Avulux lenses are precision light blockers. Let me put them on. Ta-da. They block nearly all blue, amber, and red light. That's 97% of blue, amber, and red wavelengths. These wavelengths are important because they have been clinically shown to increase migraine pain intensity. Now, they also allow a very narrow band of green wavelength, of green light, to pass through the lenses and enter my eyes. And new research is showing that green light can actually be soothing. So 70% of that green wavelength is passing through. So again, this is a precision light blocker. I am not talking about FL41 or color theory or syntonics here. Those bright pink FL41 tints never moved the needle for me in terms of symptom relief or profitability for my patients or my practice or myself. And that's because FL41 tints, they are a single band filter, so they're not nearly as precise. They're really only blocking just a small fraction of blue and green light. And remember, amber and red can increase pain intensity and cause a migraine to begin with. So they can act as triggers. And we want that green wavelength because that's soothing. So, FL41 tech, it's a legacy technology. It's been around for a long time, and these Avulux lenses represent significant advances in filtering technology. Plus, Avulux lenses have achieved statistical significance in independent clinical trials, which FL141 filters have not. So again, this is not a tint, it's a precision blocker, and it's the only clinically proven lens for people living with migraine and light sensitivity. So here's what I tell my patients. I say these glasses are like your portable dark room. They can be used preventatively. So oftentimes we can feel a migraine attack approaching. You can use them full time, you can use them part time. Use them when you're on your digital devices. If you're under harsh indoor lighting, like fluorescent lighting at your workplace or maybe at a big box store. They can be worn indoors, outdoors, again, full time, part time. They're color neutral, so they don't distort my perception of the world, and they offer 100% UV protection. I tell my patients, look, these glasses are going to relax your eyes and they're going to enable you to power through your day. And real world experience has shown that 90% of Avulux users can resume their daily activities. So these lenses are really managing the impact of light. Now, let's dive into parameters. These specialty migraine lenses are available as plano and also as fitovers and clip-ons. They also come in prescription. So standard single vision, digital single vision, anti-fatigue, office lenses, bifocals, and progressives. Another important fact is the lenses can be put into any frame of the patient's choosing, so they don't have to sacrifice fashion. And I'm really happy to report that they will soon be available as a magnetic clip-on, like a chemistry clip. So, how have I turned this cutting-edge light sensitivity solution into a subspecialty? Back when Vuity eye drops first came out, I saw a few entrepreneurial practice owners pounce on this concept and couple it with multifocal contact lenses, which we've been prescribing for over a decade, to create a presbyopia subspecialty or a presbyopia center. So, what they did, which is what I've done with my Avulux lenses, is you identify a common problem with great name recognition, you highlight a new tool, therefore differentiating your practice and adding more potential revenue. Now, if you already do myopia management or aesthetics, you know this, but there are a few universal steps you need to take in order to convert a new healthcare innovation into a subspecialty. First, you're going to train your staff, and the reps can help with this. Life as a practice owner is constant training. Train, train, and train again. Then you're going to partner with a distributing lab, set pricing, you're going to add to your fee slip, add that drop down in your EHR, display brochures if you wish in your exam rooms or optical. And then what's worked really well for my practice is identifying an in-office champion. So a staff member who really resonates with this cause and who is eager for more responsibility. So we picked one of our ABO opticians, and she is our go-to. So when we optometrists exit the exam room, we're looking for Jessica. And then, of course, you want to market your subspecialty, both to an external audience to attract new patients, but also you want to leverage that internal book of patients that list, and then repeat. The great thing about your new migraine center is that unlike myopia management and specialty contact lenses, patients don't often require numerous follow-up visits. Now, you may want to schedule your migraine patient for a status check after they've been wearing their Avulux glasses for some time, and you can bill level 3 or 4 medical for that. But again, it's not required, and I'm often prescribing Avulux lenses during the patient's annual comprehensive exam. I don't need a bulky measuring device. It doesn't really require any extra doctor time or testing. And what I tell my patient is, look, where you need your all around glasses, you need your sunglasses. And based on your history, I'm also prescribing these migraine glasses. So it's really about working smarter, not harder. And having this subspecialty is a great way to boost your multiple pair sales. So when I think about revenue per patient, and of course, as private practice owners, we do have a duty to be profitable. I'm thinking on average in my practice, if you count services and materials, the average revenue per patient in my practice is around $540. However, the average revenue per patient for my Avulux wearers is 982. So subspecialties are more profitable. This is a cash pay service like myopia management and aesthetics. And being in California, where my practice is dominated by vision care plans, I'm always on the lookout for out-of-pocket services. Plus, we don't have to deal with insurance hassles, so that's always a bonus. Now, having a subspecialty also lets you differentiate your practice, which I'm also eager to do because here in California, where we have high population density, there are often numerous optometrists in a small area. And I will add that I share a city block with another practice. However, I am the only migraine center in an 80-mile radius. So, most importantly, we love subspecialties because they also are incredibly rewarding, professionally rewarding, and they make an impact in patients' lives. This is also going to drive additional referrals. I get more referrals from my Avulux, my migraine patients than I do my dry eye patients, my myopia management patients, and even more than our specialty contact lens patients. I have never had patients sing our praises. I mean, they have become loyal, ardent followers. So here's what I encourage you to do at this time. Head to the Avulux website and check out the provider locator and see how many practices are in your area. Patients use this tool to find us and have driven upwards of 50 miles. So here now I'm attracting new patients that we've never seen. So in sum, I'm really happy to report that we now have a tool to not only attract patients who live with migraine headaches and light sensitivity, but to also help them get through their day and deal with this chronic painful condition. And it's been such a positive experience, both for myself, my patients, and my practice. So, really by reducing or eliminating light sensitivity, we can change their lives. This innovative technology absolutely belongs in the hand of optometrists. So prepare yourself because patients are going to be asking about Avulux lenses. Head to that Avulux website. For those who are listening, it's Avulux. Find that ECP section, Eye Care Professional section, and click Get Started. You can also email sales@avulux.com, and I invite you to send me questions on LinkedIn. This recording will be available. For all of those who are traveling to Atlanta today for SECO, safe travels, and thank you for logging in.